to
Good afternoon. My name is Cassandra Moore. I'm a medical oncologist at Mayo Clinic in Arizona, and am delighted to have been invited to speak with you today about prostate cancer. So just here's a quick look. Sometimes people wonder, what exactly is the prostate? Where exactly is the prostate? So the prostate is about a walnut-sized gland that's right in front of the rectum, below the bladder, and its job is really to produce the fluid for semen to help the sperm be able to travel. And as you see, the urethra, so which is the passage for urine from the bladder, um, it runs right through it. And so when you have enlargement of the prostate, either with um, benign prostatic hypertrophy or with prostate cancer, if you have a tumor pressing, that can impact that urethra and lead to urinary symptoms. So the PSA is another thing that people have a lot of questions about. What's a good number? Is it fine if I'm in the normal range? So there's no set cutoff point that can tell for sure if a man does or doesn't have prostate cancer. Um, PSA can be increased for reasons other than prostate cancer. For example, as a large prostate with BPH, as I mentioned. The prostate grows with age, so with older age, you can have a larger prostate. Prostatitis, which is an inflammation or infection of the prostate, can also um, cause enlargement. And then a variety of urologic procedures or ejaculation can also increase PSA, and hormones, definitely testosterone, can increase the PSA as well. Additionally, it's important to know that some supplements and medications may mask PSA, and so it's important for you to be monitoring the PSA under the direction of your doctor, sort of with the knowledge of other medications that you may be on. So 15% of men with a PSA less than 4 will still have prostate cancer if they undergo biopsy. People have tried to look, PSA is not an absolute, and they've tried to look at different ways, whether looking at free PSA percentage, which tends to be actually lower in men with prostate cancer. So the guideline is typically, if you're looking at your total and free PSA, if that percentage is less than 10%, then you may very well be encouraged to proceed with biopsy. Other things like PSA range, PSA velocity, and PSA density has also been studied, excuse a typo, but not necessarily found to be indicators of prostate cancer or who to biopsy. Other tests that I've had patients ask me about, like the Prostate Health Index or PHI, as well as the 4K score and the prostate cancer antigen 3, are other tests that they're trying to look at to see if they might be more sensitive than PSA for prostate cancer, but that still has yet to be determined. So, moving on to prostate cancer in general, prostate cancer is the most common cancer among men after skin cancer. However, often it can be treated successfully, especially if diagnosed early. So, if you look at the 5-year survival rate for localized or regional disease, it's really approaching 100%, whereas 5-year survival in distant disease is only 30%. And so that really does emphasize the importance of early detection. The overall 5-year survival rate for prostate cancer is 96% in African American men and 98% in non-Hispanic whites. So for African American men, they actually have the highest death rate and shortest survival of all racial and ethnic groups in the US for cancer. The death rate for prostate cancer in African American men is actually 2.2 times higher than non-Hispanic white men. African men, American men also have the highest cancer rate, and it's estimated that 1 in 7 African American men will be diagnosed with prostate cancer, compared to about 1 in 8 white men. Prostate cancer is the second leading cause of cancer death in Black men, behind lung cancer. But the good news is that prostate cancer death rate has dropped by more than 50% since the early 90s. And this is in large part due to improved treatment, which we'll talk about later, and early detection. So Hispanic and Latino men actually fare a little bit better than both African American and white, non-Hispanic white men in terms of prostate cancer. It is still the most commonly diagnosed cancer in Hispanic men. The incident rates are actually slightly lower than non-Hispanic whites, with 92 men diagnosed per 100,000 versus 102 per 100,000 in white men. Death rates are also slightly lower in Hispanic and Latino men than in non-Hispanic white men, although there is some variation within subpopulations. So, for example, a Florida study showed that Dominicans actually have a death rate twice those of Mexican, Puerto Rican, or non-Hispanic whites. The 5-year survival rates, again, 98% for localized, 96% for regional disease, which is basically if you've got spread to the lymph nodes, and then 35% in distant disease. In general, Hispanic and Latino men have lower rates of the common cancers like lung, colon, prostate, but disproportionately higher rates of cancers related to infections like liver, stomach, and gallbladder. So, risk factors for prostate cancer. Well-established risk factors include advanced age, African ancestry, family history, and associated genetic syndromes, for example, Lynch syndrome, which is most commonly related to colon cancer, or that's at least what people recognize it as, but there's also a link to breast, colon, and prostate, and pancreatic, excuse me. So there is increasing evidence suggesting that obesity and smoking are associated with increased risk of aggressive disease, particularly in African American men. The American Cancer Society recommends beginning at age 45 in Black men that there should be discussion with your doctor about PSA testing. We can talk a little bit about PSA testing later as well. So prevention is really the key. It's important at these health fairs and when we're talking about men's health that we really are focusing on men's health and not just disease. So there are things that we can do, to prevent the development of cancers. In fact, 42% of newly diagnosed cancers are potentially avoidable. That includes 19% that are found to be caused by smoking, and another 18% that are found to be caused by a combination of excess body weight, lack of exercise, alcohol consumption, and poor nutrition. So, live life healthy. Why is this so important? The foods you choose to eat and the amount of physical activity you get can impact your health as well as your prostate cancer risk, recovery, and survival if you are diagnosed. Why is this important? Recent data suggests that obesity, which is defined as a BMI greater than 30, smoking, and uncontrolled medical conditions like diabetes are associated with more aggressive prostate cancer and worse outcomes. Studies also suggest that a healthy diet and regular exercise may lower your risk of prostate cancer and help you prepare for and recover after cancer treatment, as well as helping you keep your cancer from coming back. Diet and exercise may also help deal with treatment in several ways. So physical activity can improve your physical and emotional health. It's important for managing weight, maintaining muscle, and reducing the risk of heart disease and keeping bones strong. Staying active can help with balance, improve your sleep, fatigue, and anxiety. Exercise can also help with potential side effects of prostate cancer or other types of treatment. Declining or low physical activity is associated with an increased risk of fracture in older men, likely due to the decrease in physical function and bone density. Poor physical function, which is, for example, difficulty rising from a chair, difficulty walking, balancing tasks, is associated with low bone density, bone loss, and hip fracture. Men with prostate cancer receiving androgen deprivation therapy, which is a type of hormone therapy that we'll talk about, helps. It's important for them to maintain bone health, strength, and physical functioning through an active lifestyle. So, muscle burns up to 50 times more calories than fat. So, if you increase your muscle mass with strength training and aerobic exercise, you will raise your resting metabolic rate. This can prevent weight gain and even potentially help you lose weight. Strength training, also known as resistance training, can help you increase your muscle mass and resting metabolic rate. And it's also important for maintaining healthy bones and for improving balance, which helps prevent falls. Aerobic exercise includes not only working out at the gym or playing sports, but also engaging in hobbies like bicycling, dancing, gardening, as well as doing active household chores, climbing stairs, and working at a job that has physical demands. Um, so everyone always asks me, what can I take? What food is there? What supplement can I take to, decrease my risk of prostate cancer? So it's always best to get nutrients from whole foods. We recommend, if you talk with your doctor and are found to be deficient in a vitamin, by all means, I would go along with your doctor's recommendations as to any supplements. But it's really best if you can get the majority of your nutrients through whole foods. And it's important to aim for a healthy eating pattern rather than worrying about focusing on a specific food like, cranberries or garlic that are just going to keep cancer away. It's really about eating at least 5 servings of fruits and vegetables every day, going for fruits with the deep and bright colors and vegetables. Consider eating fruits and vegetables for snacks, choosing whole grain bread instead of processed white bread, and choosing whole grain cereals. Limiting red meat, including beef, pork, lamb, and goat, and processed meat, including bologna, hot dogs, and sausages. Fish, skinless poultry, beans, and eggs are all healthy sources of protein. You also want to choose healthful fats such as olive oil, nuts, and limit saturated fats from dairy and other animal products, as well as avoiding partially hydrogenated fats or trans fats, which are in many fast foods and packaged foods. Avoid sugar sweetened drinks such as sodas and many fruit juices. You can save those for really an occasional treat. Cut down on salt, which is also huge, we know, in hypertension and elevated blood pressure. Choose foods low in sodium by reading and comparing the labels, limiting the use of canned, processed, and frozen foods if you can. And then watch your portion sizes, eat slowly, and stop when you are full. So, in summary, choosing a healthy diet, one of the things that I didn't mention but is also recommended is limit alcohol drinks if you consume them at all. The recommendation now is no more than one for women and no more than two for men. Maintaining a healthy weight. If you are overweight or obese, work on losing weight. And if you're at a healthy weight, try to work to maintain that by exercising most days of the week and choosing a healthy diet, rich in fruits, vegetables, and whole grains. And stay active, as we mentioned. Regular exercise decreases your risk of developing heart disease, stroke, and many types of cancer. Um, so going on to prostate cancer treatment, I'm just going to touch on some of these things briefly, and I'm willing to answer any additional questions at the end of the talk. So when you're diagnosed with prostate cancer, if it is localized disease, then oftentimes you will meet with a surgeon and a radiation oncologist regarding options. There are cases where the prostate cancer is very low risk. And in those cases, with close monitoring by a urologist, you can be placed on surveillance. But the large majority of folks with higher grade disease, which is typically identified on biopsy, they can get a sense of the aggressiveness of the tumor and the appropriateness of whether someone should be monitored or proceed with surgery or radiation. So surgery can be done open or robotic. Um, there is some temporary incontinence, which is common. That does usually improve, and permanent incontinence is pretty rare. There may be issues with erectile dysfunction, and you can definitely work with your urologist regarding options for treatment and management of that post-operatively. Most patients with clinically localized disease are cured with surgery. There are some high-risk patients that may need additional hormone and radiation therapy. And there are emerging surgical technology like focal therapy that are being investigated, and in the future, maybe options for certain people. Radiation therapy for prostate cancer. Um, there's often the question of external beam radiation or modulated radiation therapy. There are placement for brachytherapy. Um, you'll meet with a radiation oncologist who can go outline all of the available options that are particular for you. This is another area of advance in the treatment of prostate cancer, and so there are a lot of different ways that prostate cancer can be treated for any given individual. And this is just outlining some of the types of radiation th therapy for prostate cancer. So androgen deprivation therapy can be um, play a huge role in the treatment of prostate cancer, because we know that prostate cancer typically does need testosterone to grow and flourish. So it may be used sort of in addition to radiation therapy up front, or it can sometimes be used on an intermittent basis to keep things under control or long term. That's why for men who are diagnosed with prostate cancer and are on androgen deprivation therapy, some of those things that I outlined about diet and exercise, as well as bone health, are very important. And I'm happy to answer any questions about androgen deprivation therapy as well. So this is just to show a brief history of some of the developments that have happened since 2011 in prostate cancer. And if you look at the bottom, it shows from 1941 to 2010, there were 10 drugs approved for prostate cancer. And yet the same number from 2011 to 2020. So, a third of the, excuse me, um, quite a bit of difference in terms of the frequency and development over what period of time. So 10 drugs and 2 imaging studies were approved. And now we're really going warp speed in terms of developments. There's ongoing clinical trials looking at immunotherapy. There's new diagnostic modalities or imaging, such as PSMA, which targets a certain protein and can potentially be used down the road for treatment. There's different approaches to hormone therapy. There are other medications like PARP inhibitors. And the big development in terms of genetically directed therapies, which we will talk about as well. There's also things looking at, metabolics, and whether, obviously we know exercise remains key. There's ongoing research into diet and nutrition. There has been some positive results on the use of metformin, but this is still being studied, and there's more to come on this. There's research into how your normal gut flora or bacteria can affect your response to treatment and also modify risk factors. And then we're looking into understanding how a specific patient may respond to a certain drug. So really tailoring and personalizing our treatment to each individual. So, as I mentioned, genetics is huge in a lot of different cancers, and especially prostate cancer. It is now standard of care that and mandate that every man with advanced prostate cancer needs to be checked for inherited genes. So, 15% of men in a Mayo Clinic study were identified as having an inherited cancer risk gene mutation. This can impact not only the patient and his potential treatment options, but also other family members. The most common prostate cancer associated gene is BRCA2. You may have heard some discussion of the BRCA gene in the breast cancer talk earlier today. It can lead to cancers of the breast, ovary, prostate, and pancreas. And we actually now have therapy that targets against um, these gene changes called PARP inhibitors that may play a role and have been approved in the treatment of prostate cancer. In addition, it's important, especially in more advanced cancer that has spread, to distant areas, to really look for the tumor genetic profile and how that changes as the tumor may figure out ways around our current therapy. We're able to identify different mutations or changes in the gene that we can then target with other therapies. And with the combination of all of these, we're really becoming much better at being able to control and treat this cancer. And the hope is obviously that we will get a cure. There are now, if you just pull up the clinicaltrials.gov, there's 1,653 active trials on prostate cancer. So this is really an exciting time. As I mentioned, it was very slow. There wasn't much progress for many years, from the 40s up to, 2000 with prostate cancer. And then in the past 10 years, we had many more. And now it's really, we're having several new things developed and approved every year. So exciting time. Um, in in summary, or in closing, I guess I'd like to talk about some of the myths that I tend to hear, and just talk about them a little bit. So one of them is that prostate cancer, and I hear this so many times. Prostate cancer is something that you die with, not something you'll die from. And I think that, that there are definitely prostate cancers that are, slow growing and may not cause a problem. But there are also very aggressive types of cancer um, that can end up leading to death if they are untreated. So it's important, it definitely is important to, as I mentioned, identify and diagnose these early. With the biopsy, you will be able to get information about the behavior of the prostate cancer, and you'll really know whether it's one of these that is not likely to cause trouble. And as I mentioned, in those situations, it may be appropriate for active surveillance where there's close monitoring, but no immediate treatment. But it'll also identify those higher, more aggressive Gleason 9 tumors that can be very rapid in their spread, and causing symptoms and impact health negatively. So, so that's something that needs to really be corrected in that thought, that there are some prostate cancers that can cause problems. So you need to really identify them, be able to get information about the cancer if you are diagnosed with it, and then make educated decisions with the help of your doctors based on that. The other myth is that only old men get prostate cancer. While it's true that 65% of the prostate cancer diagnoses are in men above the age of 65, that leaves 35% in younger men. And some of those men, I've had men in their 40s, you know, that can be a much more aggressive type of cancer. And so it is important if you have a family history, if you have risk factors, if you do develop symptoms, we'll talk about symptoms next, but that you do seek your medical attention and talk with your doctor. So another myth is you don't have prostate cancer if you don't have symptoms, or you have prostate cancer if you have symptoms. And that's not the case. It's not as simple as that. Obviously, as I mentioned, the prostate, the way it is positioned, it if it gets larger, it can cause symptoms typical, as we know with BPH, with the enlarged prostate, causing urinary symptoms. And you can have a prostate cancer that's growing in a certain area of the prostate that may not cause any symptoms. So, you know, routine health care, discussion with your doctor, and screening as appropriate is very important. Um, Another one is vasectomies cause prostate cancer. That has been studied. Initially, it was thought to be true, but it was actually just that those men that had vasectomies actually had closer follow-up, and therefore they identified more prostate cancer in those patients because they were checked more frequently. Vasectomies does not cause prostate cancer. And then the last is that PSA is a cancer test. PSA is a basically prostate specific antigen. It's a protein that is expressed not only by prostate cancer cells, but also by normal prostate tissue. So there are situations where if you have a large prostate, or as I mentioned, some of the other things that can cause an elevated or a higher level of PSA, it does not necessarily mean that you have cancer, but it would be something that would be investigated by your doctor. So with that, I will, I guess, wrap up and leave it open to any questions that you may have.
The first question is written: how is prostate cancer connected or not with COVID-19?
So prostate cancer is not directly connected with COVID-19. I think that it is important if someone has a diagnosis of prostate cancer, if they are undergoing treatment for prostate cancer, there may be some impact, especially if it's chemotherapy that's impacting their immune system, that they may be more likely, as with any other infectious disease, to acquire it if their immune system is down, but there's no direct connection with prostate cancer to COVID.
Okay, thank you. And Doc, can you stop your share for me?
Oh, yes,
Thank
I'm
you.
sorry.
All right, that's okay. All right, do we have any other questions? We actually have two board members on the line, and I would like for one of them to kind of close us out. It looks like Mr. Urquhart. I'll ask you to unmute yourself. All right, you're on. Oh,
You're on mute.
okay, here we go. Here we go. You're ready.
Uh, um, Dr. Moore, first of all, thank you. But I also wanted to ask one more follow-up question about how, and you might have covered this when I stepped away, but how important / urgent is it for men, and let me go ahead and say even Black men, to be more attentive to prostate testing?
Right, sure. So it's very important for men in general, and especially for Black men who we know have worse outcomes and pretty much across the board in terms of health related things, to be proactive about their health in general. It's great in our culture with that, women are caretakers and keep keep track of everything, but really it's important for men to sort of take some of that responsibility as well for themselves, to be able to educate themselves about their bodies, knowing what's normal, what's not, asking questions. It's not, a sign of weakness to ask questions if you have about your health. Establish a relationship with a doctor who you trust and feel comfortable with, and continue to see them regularly. And then, definitely undergoing all of the necessary screening that you should, and any testing that might be done for any new areas of concern for you. Specifically related to prostate cancer, as we mentioned, African American men are more likely to develop prostate cancer. They are more likely to die of prostate cancer. And we know that we have things that we can do that impact survival if things are caught early. So definitely, as the American Cancer Society recommends, at age 45, for African Americans, if you have a family member that was diagnosed with prostate cancer, 45 is, at least. But if someone was diagnosed in their 40s, you'd probably want to be starting 10 years earlier than that with screening, and have the conversation with your doctor about screening. I do want to say one thing about screening is that, we went through a phase in health where everybody was getting PSA screening, and then it did identify some cancers, that we absolutely needed to identify and treat. And it also identified some of those lower risk cancers that I mentioned to you that might have been able to be watched. And so as a result of that, unfortunately, the backlash was to say that, well, we're over testing, and some of these things don't even need to be identified. And so then it was, it went in the other direction, and the recommendations were pretty much removed for PSA screening. PSA is not perfect, but it's what we have right now. And for men, African American men, it's important to check for these things. The other thing is that there's been data now showing that we're seeing more metastatic prostate cancer because, in my opinion, is because of that decrease in PSA screening. So I and others are working on ways to try to risk stratify men, African American men, to be able to identify, who needs the rigorous screening and who can go with standard screening. Hopefully we'll make some advances, but in the meantime, yes, absolutely, it's very important to be diligent about it.
Yeah, the other thing that, we had the presentation earlier from Dr. Halyard about breast cancer, which is predominantly a woman-female cancer, and then prostate. And too often it's still true that the respective sexes see that cancer as ours, and you don't understand.
Hmm.
And with that, the partner says, well, I can't do anything. I don't get breast cancer. I don't know what to do. And women not knowing. And I was wondering if you could speak to the value, if not need, for male-female partners to see themselves as being in it together.
Yes. No, absolutely. I think that, as with many things, your um, uh, partner is going to see things that you may be kind of disregarding because you either don't want to be bothered with it, you don't want to know what it is, or you're too busy or stressed or whatever. And so I think being engaged, and even being able to obviously feel comfortable enough to ask about, and checking in with each other about how you're feeling, making sure, I mean, there are certain standards in terms of screening for both men and women, and it's in our best interest to encourage our partners to, check in with them and say, have you had that this year? Have you had your colonoscopy? Aren't you about due for this? And then, and really, I think everyone who is diagnosed with cancer, well, the majority, I would say, diagnosed with cancer will find that that does become a true partnership, right? And so if we can start that partnership beforehand, we might be able to prevent some of that.
Right. And to the degree that you're diagnosed, going through the journey together, right?
Yes,
It
absolutely.
reminds me of, people I often hear talk about when people are about to have a child and go through pregnancy, and they use the term, "we are pregnant."
Sure, sure, sure.
And I, encourage people to think about cancer journey the same way.
Right, because it is impacting everyone.
But the fact is, we do. I mean, if I have it and I'm really in the partnership with you, and so that's what's part of whatever it is you use, then by definition, if I have it, then you have it, because we have it's a part of the we.
Sure.
Well, we are we until you get cancer. And then it's I and you. And yes, it's the emotional, we-ness that's there together. You may not physically experience the journey, but the emotional part of it and the psychological part of it is as much yours. I mean, we're in the same space.
Absolutely.
Yeah. Is there, and one final question, I'm gonna let you go and I'm gonna close out, but what about, and there was a time, and still is, I guess, people talk about dieting their way through. I guess you call it non-traditional approaches to cancer cure. Or you have any thoughts about quote unquote non-traditional approaches to the cancer journey, whether it be through diet or herbs or whatever?
Sure, sure. So I think, well, as we know, diet in general does play a huge role for health. It does have a role in cancer prevention. Um, I don't think that, can you hear me?
Yeah.
Okay. Okay. I don't think that, we have any data that shows, any particular diet can treat or eradicate cancer once you're diagnosed with it. We do know that it is important to maintain a good nutrition while you're on treatment to just help keep your body strong. And in terms of other, I think we've come so far in medicine and oncology treatment, as I showed in the past several years, because of research that's been done and that has been proven and reviewed in the. And so I think we really have to remain using those modalities that have been proven in terms of treating. I think that there are definitely, complementary things for stress reduction, and Mayo Clinic has an integrative medicine program. So there are things that can help with treatment related nausea, with stress, with anxiety, with sleep, all of these things. There is definitely a role for support, but not replacement at this point.
All right. Well, I didn't see any more questions pop up while I was talking that time, but hopefully for those listening, they were useful, and I know your answers were very useful. Thank you very much. Really appreciate you taking the time. And for those of you who joined in, thank you for doing that. We'll let you know that you may go to the Room of Hope and Help, and you may find some material in there that complements what Dr. Moore presented. We will also ask you immediately following the session, if you can get your hands and your keyboard onto a feedback sheet that we've sent out and complete it, just to give us some feedback about the session and any others that you've attended, by the way. Doing these events are good, but, we don't know unless we're told about how to do them better, but to start, stop, continue, whatever. So please take the time to do that. And with that, thank you very much, Dr. Moore, again. I hope that we will continue to be in touch as we continue to help to educate and inform and be a resource to the community on all of these issues of health. Thank you, everyone.